to Tanya Plibersek, one of the senior female members of the Gillard government, and she's speaking live in Sydney.
Okay, thanks. We had David Davis, the Victorian Health Minister, on the radio this morning complaining about the cost of caring for refugees and asylum seekers in Victoria. I just wanted to make a few points about this issue. The first point, of course, is that refugees are eligible for Medicare. They are able to visit the GP, visit the doctor, receive subsidised medicines and, of course, be treated in a hospital, a public hospital, just as any other person who's eligible for Medicare is able to do. The second point I'd make is that the hospital funding to the state of Victoria and to, of course, all of the states and territories is increasing by billions of dollars. By the end of the decade, we'll see over $16 billion extra going into hospital funding. If you look at the state of Victoria alone, between this year 2012 and next year, this year 2012-13 and next year 13-14, we'll see a $258 million increase to the Victorian hospital budget from the Commonwealth Government. That comes in the face of more than $800 million cut from the state budget of Victoria, from their state hospital system. All in all, between now and the end of the forward estimates, you'll see hospital funding to Victoria increase by over $1 billion. So by the year 2016-17, the Victorian hospital system will be receiving $1 billion a year more than it is now. A great deal of that, of course, will come from activity-based funding. The change to activity-based funding from the Commonwealth Government to Victoria means that the more patients that are treated in the Victorian system, the more people that turn up in emergency or receive elective surgery, the more funding the state of Victoria gets from the Commonwealth Government. The Commonwealth will also bear an increasing share of the cost of increased hospital services. So we're going to 45% of efficient growth and then 50% of efficient growth in the cost of hospital services. In every respect, the Victorian hospital system is receiving every single year hundreds of millions of dollars extra funding from the Commonwealth Government. And in the face of that, the Victorian Health Minister has been spectacularly unsuccessful in running his system efficiently. We see emergency waiting times blowing out. We see elective surgery times blowing out, despite the fact of increased Commonwealth funding. Another area that was raised this morning is the cost of dental care. Over the new national partnership agreements that will be signed with the Victorian Government, the Victorian system will be eligible for $402 million extra in public dental services. On top of that $402 million extra in public dental services, Victorian children will become eligible from January for our Grow Up Smiling program, a program that gives kids in eligible families, 3.4 million Australian children, access to $1,000 worth of dental care every 2 years. In Victoria, that totals about $690 million over the next 5 years for eligible Victorian children. And on top of that, there's about $56 million worth of infrastructure investments in better dental services. So I think, again, what we've got in Victoria is a health system where the state government continues to defund it. You've got a minister who's not able to manage his emergency waiting times or his elective surgery waiting times, looking around for an excuse. Any questions?
Yeah, look, you address the Victorian Minister's health concerns specifically. Do you have any concerns about the impact of the cost of dealing with asylum seekers, both in health and in other areas of infrastructure?
Well, of course, I think it's important to make sure that when people arrive in Australia, we care for them properly. But this government is focused also on reducing the number of people coming to Australia unsafely by boat. In that, of course, we've been stymied by Tony Abbott, who's refused to support an arrangement with Malaysia. We would like to see, as Paris Aristotle said last night, that arrangement continues so that fewer people risk their lives coming to Australia in this very dangerous way.
Even though you say they're getting extra funding for the health system in Victoria, surely that doesn't take away the fact that they have to pay, that they would rather not pay for the health costs asylum seekers?
Well, the point I'm making is they don't. I mean, the asylum seekers that are Medicare eligible, their bills are being picked up by the Commonwealth Government. And when you're talking about access to public hospital services, we're increasing our funding to public hospital services every single year. I mean, the difference between this year and last year is $258 million. If David Davis can't manage with $258 million more in his hospitals, you've got to ask what he's doing there with his health system.
Can I just check, is it just once they've been refugee approved that they can access it?
No, refugees have access to Medicare, and a range of people on temporary visas also have access to Medicare. It depends on the visa status of the person.
It's been suggested that New South Wales and Queensland will also be backing Victoria.
Well, I can say that the funding situations are similar in New South Wales and Queensland. I should point out that this paper that we're discussing today has been put on the agenda for discussion with state health ministers by Victoria, and it hasn't gone through the proper processes that these papers normally go through. So I'm not sure which other states and territories back Victoria's position. The health minister down there's made a number of claims, but that's not clear from the paper that we're discussing. Certainly, when you look at the health increases in funding for Victoria, for New South Wales, for Queensland, you're talking in the order of 25% over the next 4 years, some a bit higher, some a bit lower, but every year you're seeing growth of 8%, 10% in their health budgets from the Commonwealth Government, year upon year upon year of substantial growth in the hundreds of millions of dollars.
On a different subject, Minister, why does abortion need to become an election issue when that's governed by the states?
Well, of course, laws relating to when a woman might have an abortion are covered in some states in the criminal code, and most of the laws about access to abortion are determined at a state or territory level. The Commonwealth Government has a role, however, in provision of Medicare-funded services. Some terminations are funded through Medicare, and we need to ensure that when a woman is making probably the most difficult decision in her life, that she doesn't have to leap extra hurdles put in her way by unhelpful Commonwealth governments.
Have you seen any evidence from the coalition that if they came into power they would start to make changes in this area?
Well, we've seen decades of Tony Abbott's public comments saying that he's opposed to abortion. We've seen him say that it's the easy way out for a woman. We've seen him make comment after comment over decades of public life, and he's now asking us to believe that he's never been opposed to abortion. I think it's a little far-fetched for most people who know that he has been, for all of his public life, opposed to a woman's right to choose, to have him now saying that he's always supported that.
His most recent comment was that he doesn't support any changes to the way things are at the moment. Is he lying?
Well, I don't know what his intention is. I mean, he has been on the record in the past saying you can't trust a politician. He's been on the record saying if it's not in writing, don't hold me to it. All I can say is that for many decades he has been a vocal opponent of abortion, and he's now asking people to believe that he's a supporter of a woman's right to choose. One of those things isn't true.
On inappropriate comments, this menu has been going around, the photo of the menu, apparently it's from Mel Gruff's electorate from March. That's pretty out of line. Do you agree?
Look, someone showed it to me earlier today, and I frankly couldn't believe that it was true. I asked them to verify that this was not something made up. I could not believe that any person who has been a minister in a federal government and seeks once again to be a minister in a federal government could approve of something so deeply offensive. It would be offensive to any woman to read such a thing about herself. It is offensive to any woman to read such a thing about another woman. I can't imagine what the women who were at this fundraiser felt when they read this sort of thing. I think that even women who are Liberal Party supporters would have been shocked to read such a thing about any other woman. Now, you add to that the fact that they're writing about the Prime Minister of this nation, and ask yourself whether there is some respect